Figure it out. All right, we're ready to go. All right, welcome everyone. This is Dr. Clark from the Center for Weight Loss Success. And tonight on Losing Weight USA, we're going to talk a little bit about vitamins and kind of the which different vitamins. We'll talk a little bit minerals too, but which vitamins kind of very helpful. What do vitamins do? This is kind of an overview on vitamins and kind of what I recommend. Typically, what should you take? Okay. All right, so let's get on the official welcome with all this stuff. Welcome to Losing Weight USA. This is real-time answers to your weight loss questions, some of the latest updates in weight loss research, as well as a little bit of expert advice. That would be me. It does give you it gives you access not only to me, but you should be receiving the health tips and recipes via the membership portal. Each webinar is going to last about 30 minutes or so. If you have questions, just type them into the chat box as we go along. If you think of things once we're all done, just go to Yale here at the Center for Weight Loss Success. The email is success@cfws.com. Phone number 757-873-1880. All right, so let me see if I can flip the screen share on. Here's an outline of what we're going to talk about. So we are going to do a little micronutrient overview. Micronutrients different than macronutrients. Macronutrients are what give us calories or energy. Macronutrients are fat and protein and carbohydrate. Okay, so these are the micronutrients, which basically means vitamins and minerals and that type of thing. So we'll go over what are the key vitamins and minerals, what are the components of a good multivitamin. We'll talk a little bit about pharmacy grade versus over-the-counter vitamins. What's the difference? And then kind of finally, what do I recommend you take? Oh, come on, here we go. All right, so coming in, vitamins and minerals, your body requires them. Basically, we can't live without these things. Okay, so they're required in small amounts. Okay, and they're required in small amounts to keep you functioning properly. And again, we refer to them as micronutrients. Small amounts. Kind of, we almost, some of them we can't store well, so some of them we need almost daily, and so typically there are kind of daily recommended amounts that you should take in, but some of them we can store for a period of time, so it's not like you get vitamin or mineral deficient in just a day or two. It's like, no, this is something that occurs over the long term. But vitamins are essential non-caloric nutrients that assist your body in biochemical functions or biochemical equations. And what they typically do is they make these biochemical equations run more efficiently. Okay, so if you have an optimal level of these vitamins and minerals, then all these biochemical equations can run more efficiently. Minerals then are elements. Okay, they're mineral. There's something that we need to have in our body. Calcium, magnesium. These are common minerals. Most of them can be obtained from food. And this is true of both vitamins and minerals. Most of these can be obtained from food. Vitamins, we typically divide into two groups, water-soluble and fat-soluble. The water-soluble vitamins are B complex and vitamin C. The fat-soluble vitamins are A, D, E, and K. And we'll talk about these. All right, so we're going to start out with the fat-soluble vitamins. Vitamin A, and most of these vitamins actually are better taken in combination, meaning kind of any one vitamin all by itself won't do you a whole lot. Most of these vitamins actually can be utilized best in combination. Vitamin D specifically, which we're going to talk about in just a second, is actually best taken with both vitamin A and vitamin K. And it's because the vitamin D by itself can actually do what it needs to do without the vitamin A and the vitamin K. So sometimes we'll see people taking massive doses of vitamin D. It's because they have low vitamin D, and yes, they need the vitamin D, but actually the vitamin D can't do what it needs to do without vitamin A and vitamin K together. And that's not unusual for a number of these vitamins. They actually work kind of together. They work in synergy, so to speak. All right, let's start out with fat-soluble vitamins, vitamin A. Okay, vitamin A is very important in vision. So you hear about this all the time, kind of night blindness being the big deficiency syndrome. But it's very important in vision. It's also very important in maintaining the eyes and skin, but also bone and tooth growth as well as immunity. So a number of things. Typically, there isn't one thing that each vitamin does. It's actually involved in lots of different things. Vitamin D's gotten a lot of airplay in the media over the past few years as it is very important in bone health. And that's typically what we think about. You need extra vitamin D to keep healthy bones. So it does aid in bone mineralization. And it does this by increasing calcium absorption. It makes it easier for your body to absorb calcium. Okay, 15, 20 years ago, often we thought, gee, you got to take actually these massive doses of calcium. What people actually probably needed was actually more vitamin D. Very likely, most of us get in plenty of calcium. It's that we're not absorbing it well. And part of that is because we're not getting enough vitamin D. Half the American population runs low on vitamin D. And it's actually probably close to 90% of my weight loss patients run low on vitamin D. And if I had to bet, it's probably close to 95% of my surgical patients run low on vitamin D. And the ones that aren't, very likely they've been told they're vitamin D deficient or taking vitamin D already. It's really, really common. And the higher someone's weight, the more likely they are going to be vitamin D deficient. And that's part of this is vitamin D is also very important in weight maintenance or weight preservation or whatever. And when I say weight maintenance, what it's meaning is that when you have low vitamin D, there's a very close association that low vitamin D levels, people that have low vitamin D levels have a much harder time losing weight, much easier time gaining weight. Now, so vitamin D also does a lot of other things. Vitamin D actually acts more like a hormone than it does a vitamin because it does so many different things. But it also helps prevent certain cancers. It helps prevent heart disease. It also helps prevent certain neurologic and psychologic disorders. And again, it's directly related to weight. And so vitamin D, I harp on it all the time. So typically when someone asks me, what vitamin should I take? Well, I start out with just a good multivitamin. I'll be redundant because I'll get to this at the end. But I also tell just about everybody needs extra vitamin D. So that is something I recommend just about it. Doesn't matter whether you had surgery, didn't have surgery. Most people can benefit from extra vitamin D. Now, in theory, you can overdose on vitamin D. You'd have to take massive doses of it. Okay. Now, if you actually do take the vitamin D with the vitamin A and the vitamin K, you can't actually overdose on it. Because your body will, again, they work in synergy. If they work in synergy, they're basically going to help each other out, and subsequently you won't overdose on vitamin D. But in theory, vitamin D all by itself, you can overdose on. All right, vitamin E. Vitamin D is a very important antioxidant. And so when I talk about antioxidants and kind of these Losing Weight USA, there's a couple discussions I think I have on antioxidants. And vitamin E is a very important one. So it's an antioxidant that protects cell membranes and helps reduce tissue inflammation. So it's very important. You see it kind of, but also there's getting to be some evidence that massive doses of vitamin E actually aren't very helpful either. Potentially can cause other problems too. All right, vitamin K. Vitamin K I just mentioned because you need it with vitamin D. But vitamin K very important in blood clotting, but also prevents abnormal bone formation. Again, that's the vitamin D and the K working in synergy. Again, you want not just forming bone, but you want to form good, healthy, strong bone. And you need the vitamin K for that. All right, water-soluble vitamins, again, that's vitamin C and the B vitamins. Okay, vitamin C is also an extremely important antioxidant. Okay, so we'll talk about that during the antioxidants too. But it helps maintain connective tissue. And connective tissue is what holds us together. Okay, it kind of holds the muscles to the bones to the bones. It kind of helps. So it helps keep us together. If vitamin D, scurvy, which is vitamin C deficiency, back, hundreds of years ago, when scurvy was somewhat common, they'd find that people would actually, they'd start falling apart. Old scars would actually fall apart. Kind of, we'd get really loose joints and lax joints there. That was scurvy. So it's a very important antioxidant. It does help maintain connective tissue, supports immune function, as well as boosts iron absorption. So if you're iron deficient, taking iron with vitamin C will actually help absorb it. So you take the two things together. You take the iron and the vitamin C. The vitamin C helps absorb the iron because iron is very poorly absorbed. All right, the B vitamins, there's actually 8 different B vitamins. I listed them out there: thiamine, niacin, riboflavin, folate, B6, B12, biotin, and pantothenic acid. Now, I have a whole, Losing Weight USA on B vitamins all by themselves. But basically, B vitamins aid in energy metabolism. And they do this by helping the body metabolize, break down, and utilize the carbohydrates, the protein, and the fat. Now, we often think of B vitamins as energy vitamins. Okay, so we often refer to them as their energy vitamins, but B vitamins themselves don't actually give you energy. What they do is they make the energy producing equations run much more efficiently. And so the B vitamins themselves don't give you energy. They make the equations that produce the energy run much more efficiently. And that's how we, quote, get the energy from it. So B vitamin symptoms of low B vitamins. Okay, symptoms of low B vitamins include exhaustion. They're typically kind of neurologic types. I feel fatigued all the time, irritable. Anemia is another one, but also depression, forgetfulness, loss of appetite, skin problems, impaired immunity. See, immunity pops up all the time with most of the vitamins. All right, so kind of hit a little overview on the vitamins. Let's talk a little bit about minerals. Minerals are inorganic, non-caloric substances. Again, your body requires them, relatively small amounts, and again, it's ensuring proper functioning. So it's all these biochemical equations that occur in our body. We need these minerals to do that. And then we also need minerals just for structure too. They're very important in bone health. So they perform a number of essential duties, including maintaining water balance, assisting muscular contraction, and as well as transmitting nerve impulses. So minerals, extremely important, and each of them do different things. Calcium is probably one of the most common mineral in our body because it's bone formation. And so most of our bone is calcium and phosphorus and magnesium. Okay. We don't not just calcium by itself, but it's absolutely essential in bone formation, but also water balance regulation, muscle contraction. So if you don't have calcium, you'd actually go into tetany. If you have tetanus, is where your muscles all contract. So you need appropriate levels of calcium, but also then muscle relaxation too. It's not just, not just kind of contraction, but also relaxation. Very important here. Blood pressure maintenance. That's how one of the blood pressure medication works, is a calcium channel blocker. It actually then helps lower blood pressure. But in order to maintain our blood pressure, we need calcium. As well, it helps in all kinds of secretion of essential enzymes and hormones. Phosphorus, again, goes along with calcium, and it's bone mineralization, so bone formation. But also, phosphorus is the money, if you want to call it that, of our overall energy metabolism, because our overall energy is measured in ATP, adenosine triphosphate, and phosphate on the adenosine triphosphate is phosphorus. So we have to have phosphorus. We can't even have any energy. Well, that's zero without phosphorus. Magnesium, very important in bone function, but also muscle function. It's also protein synthesis, enzyme activity. Now, magnesium is one of the things that I recommend just about everybody needs extra magnesium, because magnesium actually functions in like 300 or 400 different equations throughout your body. But one of the more important ones is muscle function. If you're prone to muscle cramps, prone to muscle soreness, magnesium is one of the best things you can take. Now, magnesium also helps with keep bowels regular. So it's the working ingredient in milk of magnesia. So most people could benefit from extra magnesium tablets. And if you actually take magnesium tablets, it will help bowels stay more regular. So if you're prone to constipation, actually not a bad idea. Take a couple magnesium tablets throughout the day. And it can actually help with muscle function. Your intestinal tract is a muscle, so it can help squeeze better, push the stuff through better. Sodium, people are often very careful about their sodium content or how much they take in, but we can't live without sodium. We would die very quickly without salt. We need it. It helps maintain a pH balance. pH is our acid-base balance, but it's also essential in muscle and nerve function. And it regulates our water amount, the total body water, as well as our blood pressure there. So sodium, we can't live without it. Potassium, also, we can't live without it. Maintains fluid and electrolyte balance, assists in nerve function, as well as muscle contraction. Sometimes when potassium levels run low, their muscle contraction is very poor. And also we think about that, if someone gets muscle cramps, they all say, oh, you got to take more potassium. I think about bananas and things like that. Typically, that's a magnesium problem, not a potassium problem, although potassium does play into it. But it's typically more likely a magnesium problem. All right, other minerals are not quite as common. Iodine, essential for thyroid function. We talk about that during the thyroid discussion during Lose Weight USA, which is later on there in the year. Iron, and actually most people don't get enough iodine. Let me back up to iodine again for a second. Most people don't get enough iodine. Iodine used to be added to all kinds of food. It's been taken out of almost all food, and it's been replaced with bromine. And bromine actually in Europe is it's taken off the market because it's a toxin, potentially toxic. But many things that used to have iodine now have bromine in it, and so potentially these toxins have been added to our food. That's a different discussion, but again, iodine has been taken out. Really, the whole point there is that most Americans don't get enough iodine anymore. There's a little bit in iodized salt, but not nearly enough to really matter, and most people are careful with their salt intake. Anyway, so iron, just not to belabor too many points here, iron helps carry oxygen in the blood. And so, yes, we can't live without iron either. And iron deficiency is one of the most common deficiencies and most common nutrient deficiencies there are. Much more common in women, especially young women, if they're having cycles or if they're having more heavier cycles than normal, they tend to run low on iron. But iron deficiency, again, very common. And symptoms there include, just fatigue, weakness, but also, again, immunity pops in there. So if you're low on iron, it's hard to maintain immune function. Zinc. Zinc we talk about all the time, and also with immune function. So you often see advertised on TV. You think you're coming down with a cold or exposed to cold, they actually take high dose zinc. They sell a bunch of products that basically what they're based on is high dose zinc in there, and you can get these lozenges and things like that. So zinc itself helps activate many enzymes. It also, most people could use extra zinc anyway. Zinc also does help just a little sidelight, and it actually can help improve testosterone function. So can magnesium. So magnesium and zinc. So if you're looking to kind of boost testosterone, that both magnesium and zinc can help do that. It's not like all of a sudden it's going to go off the wall or anything like that, but it actually can be helpful. Chromium is also a mineral. I talk about chromium all the time when we talk about cravings, because chromium helps with kind of regulate blood sugar swings. So it works closely with insulin to regulate and release energy from glucose. So what it helps do is regulate blood sugar swings. Low levels impair insulin activity. So it's not only that you could benefit from the chromium, but just having lower chromium levels, insulin won't do what it normally needs to do as effectively. And so subsequently then adding chromium can actually help with insulin resistance type of thing. All right, I also mentioned chromium and cravings, and typically with cravings, you need to take it at least 3 times a day. That's a little sidelight there in chromium. Okay. Components of a good multivitamin. Obviously, there's all kinds of brands out there. There's lots of things out there, and it's kind of let the buyer beware because the FDA does not regulate multivitamins. Okay? But a good multivitamin should provide all the vitamins in doses close or exceeding the RDA. You just have to remember that RDA, or recommended daily allowance, is the definition of the RDA, is that it's the absolute minimum amount, which will help prevent a deficiency syndrome. Again, it's the absolute minimal amount, which will prevent a deficiency syndrome. So it has nothing to do with an optimal dose. So sometimes people, oh, am I gonna hurt myself, or there'll be a problem if I take, more than the RDA word. It's like, absolutely not. It's the absolute minimal amount, again, to prevent deficiency in most people. So actually, some people, even that's not even enough. So it has nothing, again, to do with the optimal dose of a vitamin or mineral. So for most nutrients, the actual optimal dose is unknown. Now, the other end of the spectrum also is that there's probably not a whole lot of benefit of taking 5,000% of what the RDA is. And it's probably somewhat superfluous. For certain vitamins, B vitamins specifically, that it certainly won't help you, or excuse me, it won't hurt you to do that. But there's probably not a good reason to really do that. So vitamins, vitamin supplements, pharmaceutical grade versus OTC. OTC is over the counter, which you can walk in any pharmacy and buy it. What does pharmaceutical grade mean? Pharmaceutical grade vitamins basically mean they're made under the conditions set forth by the American Board of Pharmacy. So what that means is hopefully you can really trust its content as well as ensure the best absorption and utilization. So there are kind of a number of things that have to occur when you take a multivitamin. One, it has to be able to be absorbed well, and then your body actually has to utilize it. So when you buy a multivitamin, I do encourage people to use pharmaceutical grade. Now, if you're not going to use pharmaceutical grade vitamins, I would recommend, if you're getting an over-the-counter quality vitamin, is use a vitamin from a corporation that made its name making vitamins, meaning this is what they do. So kind of the one-a-days, the Centrums, this is what they do. That's where their name came from. I don't recommend using kind of generic vitamins. Generic vitamins, you have no idea what's really in them. The labels may look exactly the same between a pharmaceutical grade and an over-the-counter grade, but that doesn't mean that's what's in there. Again, the FDA doesn't regulate it, and there may be a lot of things in there that you don't want, from who knows how many rat hairs or whatever are sitting in there. So again, over-the-counter vitamins and minerals are not held to the same high standards. And there have been a number of studies that show that content may not match what's listed on the bottle. So again, let the buyer beware. So what we have in our store, obviously we have pharmaceutical grade vitamins. So it does kind of guarantee what you're paying for. What you're getting is what you're paying for, and vice versa. So what do I recommend? Kind of winding this all down, what do I recommend? Just about everybody ought to take a multivitamin. And the main reason is because, the typical American diet just doesn't get what it really needs to get. And even if we're trying to eat as healthy as possible, say eating green, eating clean, eating, basically trying to get the best food out there, preparing it ourselves, part of the problem is that a lot of the soil has actually been contaminated, but also a lot of the soil we can't actually get all the best vitamins and minerals from the soil anymore. Typically then we're adding it to the soil, and therefore we're getting it that way, and that may not also be the best thing. So just about everybody should take a multivitamin. I encourage just about everybody ought to take vitamin D too. So what I'll call top tier, multivitamin and vitamin D. Pretty much everybody needs it. Other things that can be very helpful: essential fatty acids, B complex. Again, I encourage most people ought to take extra magnesium, especially if any muscle function dysfunction. So we have a magnesium potassium combination tablets. And then a little other things that can be helpful, calcium, but if you're getting your vitamin D, you probably are getting your calcium in. Chromium, as I mentioned, chelated iron. Chelated iron, I didn't really go over this earlier, is the iron molecule. If you run iron deficient, the iron molecules on this chelated iron are connected to a couple amino acids. And by doing that, they're more efficiently absorbed. If they're more efficiently absorbed, you often can take a smaller dose. If you take a smaller dose, you may not get some of the side effects that people taking iron sometimes get, such as constipation, a little nausea, that kind of thing. And then finally, potentially carb blocker can be helpful. We talked about this I talked about this in the videos, that video series I did on the Jumpstart diet, is potentially a carb blocker for those people that are very sensitive to carbohydrates. A carb blocker can be helpful for two reasons. One, it kind of decreases the amount of carbohydrate that's absorbed during that Jumpstart diet, but it really can be helpful for anyone trying to keep their carbohydrate low. And what it does, it basically converts the carbohydrate that would be absorbed into a non-absorbable carbohydrate, which is basically a fiber. And so you're basically increasing fiber that you take, which can help with constipation. And so subsequently then, carb blocker can help not only decrease the amount of carbohydrate absorbed, but it's kind of increasing your fiber content, which subsequently make you less prone to constipation. All right, a little throw this out there. This was back here last year, a couple of years ago, we put this book out, Dr. Reese and myself, Back on Track After Weight Loss Surgery. We now actually have a full digital program that you can, if you go to our website, you may see kind of that Back on Track After Weight Loss Surgery digital program. It's a downloadable thing where we walk you through 8 different classes, as well as a whole bunch of extra things with that to kind of how do you truly get back on track and get kind of back going in the right direction if you struggled. Questions out there? Well, let me flip on here. And if you have questions, don't hesitate to pick up the phone and ask, or send us an email. The email again, success@cfws.com. All right, little reminder, stop by the Center for Weight Loss Success. Get your body comp done. I hop on this every week. You want to make sure you're losing fatty tissue, not losing the lean body mass. You should be receiving the weight loss tips and weekly recipes. Tune in each Tuesday, 6 o'clock for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good evening, everyone. Take care.